Hello, my name is Arnold. I'm going to be taking care of you today. We're going to do abdominal examination. So for this, we want to make sure the patient is supine. We want to make sure that the patient has his abdominal muscles relaxed. We could do that by handing him a pillow, making him comfortable. And if we need to, we could ask the patient bend his knees, or we could prop a pillow underneath it. In this case, he looks pretty comfortable. So we begin with inspection. We're going to inspect the abdomen. We're going to look at the skin color. We're going to see if there's any prominent veins. Look at the umbilicus if there's any obvious protrusions indicating a possible hernia. Look to see the contour of the abdomen. Look for any ascites, any stretch marks, any obvious bruising, or any skin lesions. Or any pulsations that we might be able to see. After we inspect the abdomen, we're going to move on and auscultate. So for the auscultation, we're going to divide the abdomen in 4 quadrants. So we're going to create like a little cross here. It's going to be the right lower quadrant, left upper, left lower quadrant. And we're going to be using the diaphragm with the stethoscope, and we're going to be listening to all quadrants. And we should be hearing between 5 to 35 sounds per minute. So we're going to go ahead and start that. I'm going to warm up the stethoscope a little bit so it won't startle the patient. Okay, so he does have over 5 vowel sounds present. They're pretty active. So now after we auscultate for vowel sounds, we're going to now auscultate for the aorta, which is superior to the umbilicus, and we're going to use both the diaphragm and the bell for this. We're auscultating for any bruits. Then we're going to check for the renal arteries, which are right next to both sides of the aortic site. Okay. Now we're going to check. We're going to auscultate for bruits on the iliac arteries, which are located a little inferior to each lateral side of the umbilical area. We're going to be using both the diaphragm and the bell for this. And we're going to also auscultate for bruits on the femoral site. In this case, I'm not going to lower the pants, but it should be skin to skin, but we're going to auscultate over the pants in this situation. So as I mentioned, for all the areas that we auscultated, for bruits, it's both the diaphragm and the bowel. Another auscultation that's worth mentioning are for friction rubs, and those are done in the right side for the liver friction rubs, and in the left side for splenic friction rubs. And we're going to go ahead and auscultate that. You can ask the patient to take a deep breath. Just listen for the friction rubs. So as far as auscultation goes, we're done. Now we're going to move on to palpation, to percussion. I'm sorry. We're going to percuss all 4 quadrants, and when we percuss, we're listening to tympany. We will see or listen to some areas of dullness, which usually represent fecal matter or liquids. So we're going to start off, again, all 4 quadrants. Okay, so we had most areas tympani, which is air and intestinal contents in the abdomen. And now we're gonna percuss the liver, and we're gonna use the midclavicular line, and we're gonna start percussing from the midclavicular line, just about next to where the umbilicus is, and we're gonna move up, and we're gonna go from the tympanic sound until we listen to the dullness. That's where we're gonna stop. We're gonna mark it, and then we're gonna move on to measure the top portion of the liver. And then we're gonna, when we get both markings, we're gonna measure it, and it's basically gonna tell us the size of the liver, and it should be between 6 to 12. So we're gonna start with the percussion. So we mark it with a pin, and then we start again with clavicular line, the nipple line, and until we hear the dullness. We mark it, then we measure it with a ruler, and as I mentioned, it should be between 6 to 12, and that's the normal size of the liver. If it's any bigger, it's an indication of enlarged liver. Now we're going to percuss the spleen, and there's two methods for percussion of the spleen. One of them is going to the last intercostal space. We're going to percuss, and it should be resonance because of the lung. We're going to ask the patient take a deep breath and continue percussing. Take a deep breath in. And it's still resonance, and that's if we ever hear some dullness, it could be an indication of some splenic enlargement, and that's one of the percussion methods. And the next one would be starting from the anterior lateral and moving on to the side, and it's the same thing. We're gonna be listening for any dullness. If there's ever any dullness, it might indicate splenic enlargement. Take a deep breath, please. Okay, so no dullness was noted. Now we're going to move on to palpation. So we have two types of palpation. We have light palpation and deep palpation. We're going to start off with light palpation, and what we're looking for is for any rigidity, any tenderness, rebound tenderness. With light palpation, we only use one hand and lightly palpate all quadrants. Okay, now we're going to do deep palpation. With deep palpation, we use both hands, push in, and it's for any for detect any masses or any tenderness as well. Let me know if you have any pain. Okay. Okay, so tenderness or masses. Now we're going to palpate the liver. So there's also two techniques to palpating the liver. And we're going to go starting here and then up below the costal margin, and then move up. Once we're here on the right side, we're going to ask the patient please take a deep breath, and we could use our left hand and push this up. Please take a deep breath. And we're palpating for the liver, and it is normal to feel the tip of the liver. It should be smooth and soft. If it's rough or you feel any nodules, it's a abnormal finding. The next technique, it's a hook technique. So we're gonna use this hand and get the rib as like a hook. Then ask the patient if they could please take a deep breath. Use this hand to prop this up to get a better feel. Please take a deep breath. Okay. So once again, it's a normal finding to feel the edge of the liver touch the tips of the fingers. Now, next we're going to palpate the spleen. It's almost the same technique, and we're going to use our hand, and by the costal margin, we're going to palpate, see if you feel the spleen. We could use the other hand, push this up. Then we're going to ask the patient, can you please take a deep breath? Okay, so we shouldn't be able to feel the spleen, although 5% of the people you're able to feel the spleen, and I believe that concludes our abdominal assessment. Thank you.